typically when people are in a hospital, they're stuck to a bed and they're given in the bathroom a little plastic dish with a very hard toothbrush and a little toothpaste. And if they don't think of brushing their own teeth, it doesn't happen. So, one of the things that I like to recommend to people visiting others in the hospital is to bring a soft toothbrush and encourage them to brush.
Absolutely. Thanks for having me, Eva. I've really been looking forward to this.
Yeah,
Um,
this is exciting. I mean,
I am. I'm very
is there
excited,
a
and I love the
brush?
jingle.
Yeah. Is there a brush that you recommend to your elderly patients?
There is, and I can just to confirm what you've just said. I work actively on the wards, and any of the guys here who do, or anybody who's been on the wards, in 40 years of walking onto a ward, I've never been asked by a patient, "Can you brush my teeth?" It's not something that's, "Can you do my hair? Can you get my dad to the toilet?" Blah 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 blah. Can you clean my dad's dentures? Maybe, but never natural teeth. And it's such a really important thing that goes, it's missing the size of the toothbrush and how gentle the toothbrush is. And I'm sure Joss has spoken to you. You need something very small and very soft, medium to soft,
Right.
because especially if we're looking at the elderly, which is why I'm here today, because it's close to my heart. The elderly, the mouth is just skin, and I sort of get it in my head that it's wound care, especially with our head and neck patients. It's like treating. I'm training at the Christie in Manchester at the moment, and I'm trying to get them to think about the mouth as a wound rather than just another a mouth. Dental care, of course, we've got to look at teeth, but it's wound care as well. And as you get older, which I am doing, Eva, our skin becomes a little bit see-through on our hands, and it can become a little bit fragile. The same happens in our mouth, because the mouth can get it, we can traumatize the mouth quite easily and quite readily. So it's really
Right.
important to have a nice, soft, small-headed brush.
And then if you use a hard toothbrush or something with sharp bristles, it could actually cut
Absolutely,
your gums and then
absolutely.
possibly create an infection that goes systemic.
And then you struggled, and we've all done it, guys, haven't we? We've all been brushing our teeth, and we've slipped, or we've been a little bit overzealous because the dentist has told us we haven't been brushing in a certain area correctly, and you can then traumatize the mucosa. We call this, that's a posh word for the skin
So
inside
if
the
you have a
mouth.
parent with, let's say, dementia,
Yeah.
is that something that's cared for dementia patients, their oral health?
Oral health, and I speak from experience because, as I mentioned previously, my mum has got dementia, and my mum's was a dental nurse, so for 30 years. So, but that's gone out of the window now. My mum struggles to even know what a toothbrush is. So, it's now getting into the narrative of having to try and get them to remember what a toothbrush is, explaining to them. But actually, even getting into somebody's mouth with dementia can be a little bit challenging. So it's how you approach the individual and let them lead, and try and use toothbrushes and toothpaste maybe that they're familiar with. I always ask the carer. So if anybody was coming to look after my mum, I would expect them to ask me, what's my mum's routine? And if my mum wants to brush her teeth in the back garden, and I'm not joking, or anywhere else in the house, we'll do it there. Maybe in a mirror so she can watch what she's doing.
So would you say that oral cancer survivors or people, let's start with oral cancer patients going
Yeah.
through treatment.
Yes.
Would you say that their oral tissue is like a person who's 100 years old?
It can be. It can be. The treatment, I always say, assaults the mouth. It is quite an onslaught, on the mouth. So making sure we're using the correct equipment to look after the mouth is paramount. And
So
an
did you say
educated
salt the mouth? You mean rinse with salt water?
salt mouthwash, again, guidance. If you look on our website, it'll give you some ideas on that. I'm a great believer in going back to the stuff we used years ago. My nana will have used a saline salt mouthwash, and it'll clean the skin in the mouth. I know I keep going on about skin and wound care, but I think we need to remember that either if this condition was happening anywhere else in the body, we'd be able to dress it with a dressing, we'd be able to look after it in a different way, but we're asking them to eat, drink, communicate, talk, on that wound, around that wound. So it's really important that we understand that for the patient and try and keep it clean best we can.
So, can salt water rinses
Yes.
affect the mouth of an oral cancer survivor in a
It
negative way
I mean,
because it
overcooking,
dries them out?
it
Can
can dry
salt
the mouth, but it you've got to balance it out.
so the
So for
benefits
example,
outweigh the risk?
absolutely. So if I've got somebody who's starting on with cancer treatment, and I know they're going to start, we're going to have head and neck cancer treatment, I advise a saline mouthwash even before we start, gets them into it. And I always ask them to do it tepid, warm.
Right,
Cold saline is not pleasant
so do
either.
you just use regular table salt?
Yeah, you can do. Again, any guys on the ward, they'll have little ampules of it or bottles. So a teaspoon in a tumbler of water, tepid. My son's just had his upper wisdom tooth out. We did the same with him the day
Mhm.
after. And he actually was rinsing with it and he went, "Do you know, Mum, that soothes it." And it does. But again, obviously, it can dry the mouth out. But we've got to keep that. Again, if it was anywhere else in the body, that's what you would clean a wound with. Or even normal, just normal water. Normal
Okay,
water.
so
Sorry, Karen.
what rinses do you recommend for
For,
fragile oral tissue?
so, just to put it into context, district nurses now here, if they clean a wound anywhere else in the body, it'll be just normal water. So, yeah, so back years ago, it was saline. They will just use normal sterile water. So, even water will do. Again, guys, I have to remind you that my mum can't rinse because of the dementia. So you have to also remember that as well. But I can then bathe it. You can bathe the area if she'll let me bathe it with a gauze swab or some of the actual swabs you can use in the mouth. Especially if she's getting little wounds at the corners of her mouth, angular colitis, we
Mhm.
call it. I will bathe that with a saline as well. But if you can't, if you're worried and they don't like salt, just normal water.
So when I was in the hospital going through the 10 days after my treatment, my surgery, where I had a third of my tongue reconstructed and a radical neck dissection, I was not able to brush my teeth, obviously. But in the hospital in the United States, they gave me a little sort of a lollipop with a minty sponge at the end, and
Yeah,
I could very gently open my mouth and then sponge my teeth with this
yeah,
minty.
yeah. So we have some sponges over here in the UK. It's the pinks. We did have some other sponges which were banned because they did actually come off the stick. So you have to check the integrity. But just for some context, I hope I'm not talking too much. The sponges were left in the water all day, so that now again, I know I'm going on. If that was wound care anywhere else, that wouldn't happen. You would use them, clean and bin. So we do have other sponges that we can do, and we can drip, as you say, end of life. I actually let them pop it in. Don't tell anybody, but a little bit of lager or whiskey, whatever they want to, what they want to suck on. But again, yeah, you can bathe and clean that area because it can be too painful for a brush, but it's got to be cleaned. As you mentioned before, Eve, it's really important. You can get a
So can
secondary infection.
anyone buy a sponge toothbrush like that online?
You can get them online.
Mhm.
I'm sure we can
Okay.
give them the links. But if you Google pink swabs, there are other swabs called moist sticks, and the only way I can describe those, they're like giant earbuds, and they can be used. They're very very gentle, and they can be used. They're not a sponge. They're like a stick. It's like a giant earbud, like I say, and
Hmm.
that can be flavoured as well. I think they banned the lemon and glycerin one because they actually dried the mouth out and they can actually
Ah,
sting. You've got to remember that mucosa is sensitive in there as well.
that makes sense. Talking about acidic foods for
Yeah,
everybody on this call, please make sure that if you're eating anything with acid, a peach, an orange, you want coffee. You want to wait 30 minutes before brushing your teeth because the acid makes the enamel soft, and then you brush off some of that soft enamel. Um, so, do you recommend, Emma, that we brush our teeth first thing in the morning, Or should we brush our teeth after having our morning coffee and waiting the 30 minutes?
So again, if you've got somebody with challenging behavior, or you've got somebody who doesn't, there are issues with that. Um, with my mum, the main time for my to get my mum's teeth brushed are before bed. If I can do it effectively once a day, I want it twice a day, Eva. So first in the morning. My mum, you also find with people with dry mouths that they increase their sugar in their diet because their taste buds are compromised. So they'll graze through the day. Again, with the elderly, we want them to graze. You know, it's never written in law that you have to have breakfast, lunch, and tea at certain times. We've, as human beings, we've done that. So with my mum and with people who are over a certain age in care homes, we get them to snack during the day. So it can be a nightmare then when to think, am I allowed to brush my teeth? So first thing in the morning, if possible, and before bed is critical, because that's when the bacteria in the mouth is at its worst. Does that make sense?
Right. Okay. So when saliva is compromised, you want to basically brush as much as possible because the saliva is not removing all that bacteria.
It is. It's when we're brushing. So if my mum's got snacks and she's having a biscuit, or the special Ensure drinks that my mum can drink, they're high in calories and high in sugar. So you'd have
Right.
to wait after you've had that to then brush your teeth. So it can become a little bit confusing, especially for carers.
Let's open this up to everybody. We have a few more minutes. How many of you have any questions about oral cancer, caring for the elderly, caring for yourselves with your oral health?
I
If
think
nobody's
Karen's
got a
just
question, Emma, maybe you could talk a little bit more about the properties in saliva and how important saliva is to digestion for
well.
everything in our ability to eat.
Saliva is so important. Karen, I'll answer your question shortly. Saliva. I don't know whether over here in the UK now we've got there's going to be a test for prostate cancer taking a sample of saliva. It is so clever, saliva. Without it, the environment of the mouth goes into overdrive. It's so important. Over 99% water. The rest are all these enzymes that we need to keep the mouth healthy. So when we take saliva away, as you know, Eva, being somebody who's been through treatment, it compromises everything.
Totally.
Digestion starts in the mouth. Your taste is affected. It's like running a
Right.
car without oil. So we have to.
Karen,
Sorry.
I just wanted to respond to Karen. First of all, thank you for asking a question and starting a dialogue here. I'd like to answer your question by saying that, and I think, Emma, you would agree that not every product is for everybody.
No.
And just because your dental professional might say, try rinsing with this, if it doesn't work for you, you have got to stop immediately and try something else. I had a periodontist who said to me, why would you rinse your mouth with a mouthwash if you don't need it? Because a mouthwash is actually a bunch of chemicals. So, do you need to rinse your mouth with chemicals? Unless you feel like it does you good, don't use it.
No, and we answered Karen's question by saying if they don't like saline, then use water. At least you're rinsing the mouth with something. Again, skincare, wound care. You're dead right, Eva. You wouldn't be putting loads of chemicals on a wound. You would,
One of the
you would clean it.
products that I really like, Emma, is Act. You know, the mint Act. You have that in the
Oh, but that might be too minty for some people.
Oh,
It's
it's actually too minty for me, but I water it down.
yeah.
And I find that that just little bit of minty taste, it really freshens my breath. I don't have any side effects. Like when I go to sleep at night, I don't feel my mouth particularly dry after using it. But what other things should people look out for after using a product? And what could be causing us a potential problem? Other than dry mouth or maybe sores? What else?
Sores, dry. You've got it. So again, reinforcing that the mouth is so sensitive, and looking after the skin in your mouth, the teeth in your mouth, making sure that nothing is too acidic. You've mentioned, we call it the pH levels in tomato. You've got to look at what's in your product. For me, I think we keep it as gentle and as simple as possible. One complaint a lot of my patients tell me is that they've got so many products, they don't know which one's doing what. And I think it's important that you know what you're using in the mouth, which is why, being an old girl like I am, saline and normal water are the best. Possibly a non-foaming toothpaste, because sometimes the foaming agent can make it a little bit strong in the mouth.
Right,
Even
that's sodium lauryl sulfate.
sodium lauryl
And
sulfate,
what toothpaste do you like to recommend?
anything without sodium lauryl sulfate in. And a lot of our
I
toothpaste over
I
here are removing
personally
it.
like the very plain Crest,
Yeah.
not just the anti-cavity, not with the whitening, not with the scope, none of that. Just a plain Crest.
You've got to have fluoride in it. I am for fluoride, and see if the foaming agent's not in it. But a lot of them are removing them. I prefer foam because my brain likes the foam. It's because I've used it for 50 odd years now. But that foaming agent can be a little bit too strong. Now, if I'm brushing the teeth of an elderly person, I prefer to use a non-foaming toothpaste because I can see what I'm doing.
Oh, interesting.
It's
Okay.
easier for us
Well,
carers to use that.
we've almost come to the end of our webinar because we keep it to 20 minutes. We respect your time. If you have any other questions that you want addressed in these webinars, please send it to the Mouth Cancer Foundation, info@mouthcancerfoundation.org. And we will make sure to find an expert to answer your questions. So I'd like to conclude by suggesting that we all today look in our mouths, get to know what's normal, get to know the odd areas of your mouth. Like Emma, would you say that sometimes along the inside of the cheek, it looks a little different?
It
The
does.
floor of the mouth, right?
Know the anatomy of your mouth. Have a look in. Know what the only person who generally looks in your mouth is the dentist or the hygienist, maybe once or twice a year. So have a look in. You check everywhere else. And just to very quickly answer Karen's question, yes, we are seeing head and neck patients in the community, in the care homes. We are seeing cases of mouth cancer in care homes. So
Wow.
please, please,
I
please.
recently met a man who wears dentures for 40 years, had no idea that he needed to see a dental professional, and developed oral cancer.
We're seeing
It
a rise
happened.
in the care homes. And before you go, guys, please go on the website because we have a leaflet for care homes. And it is look, observe, smell, and listen. All these things, because we might not be able to get into these mouths. It's just having a look to see if something's changed. But to answer your question, unfortunately, we are seeing them in care homes and residential homes.
All right, so everybody get to know what's normal in your mouth. Thank you, Emma Riley, for sharing all your wisdom today. And once again, ask your questions to the Mouth Cancer Foundation and we will answer it. Mouth Matters, open and honest conversations about oral cancer and oral health. Thank you, everybody, for joining today. See you next month.